Leadership in healthcare is often measured by outcomes, decisions, and performance. Behind every healthcare system are people carrying invisible weight. Confidence is not where the journey begins. It's something built slowly through experience, challenge, and support.
Upon reflecting on my leadership journey, I think it really began even before I became a physician. And stepping from that student role to that intern role, where you then have responsibility for the students, if you will, below you, was probably among the first times that I felt like I was emerging as a leader. You think about that pragmatically in caring for patients and assuring that care that's being provided by the students aligns with just what we would hope to do. But you think about that also in the context of them watching you and you serving as an exemplar.
So I spent about 17 years helping leaders be better leaders. All of my study and all of my energy went into helping understand leadership principles and philosophies and getting to know the stories of individual leaders and the challenges that they were facing and helping them co-create solutions. And then I was offered a leadership role. Individuals saw something in me that would help the organization. So I said, yes, let's figure this out. And it was that moment of knowledge and action and the practical application of it that just changed me.
Healthcare leadership is rarely loud. The pressure to lead does not remove uncertainty. In many ways, leadership means learning how to move forward while uncertainty still exists.
I had an experience early on, and this was before I was in a leader, I was leading a project. So I think leaders come in multiple different ways, right? So at this point, my leader had asked me to step in and lead an organizational-wide transformation. I was relatively young in my career and looked at him and said, I don't know that you have the right person. And he said, I have the right person. Can you help us out in this way? I said, I will help you out to the best of my capacity. And when I fail, I'm gonna need some help. And he said, I am right here with you. You've got this. You're not gonna need me, but if you do, I'm right here. Like, he just walked with me.
And that's one of the interesting things about medicine, is that we're continually confronted with what we know, but then what we don't know. That experience, I think, introduces uncertainty, and you realize very quickly that you have a vulnerability in your knowledge and knowledge gaps.
And to kind of trust myself as things progress and you gain more experience and exposure, and you begin to say, oh, I've been through this before. I have the experience to do it again, or at a higher level. I think it's that just practically being put in situations that stretch you, that give you the confidence to take that next level.
Support systems matter. Coaching, mentorship, reflection, and trust often become the difference between isolation and growth.
I'm really lucky when I think about how coaching and mentorship has affected my development, because I've been able to have coaches and been formal mentors at really each step along the way. Perhaps physicians are often well aligned for leadership because that coaching, mentorship model is not unfamiliar.
I think we all experience imposter syndrome. I think the most confident person that you see in front of a room or behind a camera experiences it just like we all do. So I think it's this moment of openness with yourself, and I feel like sometimes we as humans so focus on all the gaps that need to be closed instead of celebrating where I'm at. I'm a big believer in playing to your strengths, to be very honest with you, and surrounding yourself with people who have strengths that are not like you. And I believe that a great portion of my leadership is equipping a very well-rounded circle of skills, and they don't all have to come from one person. I think building trust is one of the most critical capabilities that a leader has. So being able to focus on individuals becomes really important. I'm a firm believer that work will get done, and people matter.
What really resonates with me is having a North Star that it primarily revolves around the patients and the patients that I care for. If I start there, then it's very natural for me to proceed in a way that I'm showing up for others to see where my allegiance resides.
The future of healthcare will require more than expertise. It will require leaders who are adaptable, reflective, compassionate, and willing to keep growing.
Perfectionism is unattainable, and you only grow when it's hard. Every one of those hard things, every one of the new projects that you tackle, every one of the conversations that you have, they grow your capacity. The whole world of technology and AI is new for all of us. We know we have to get there, but I don't think we know how.
When we're confronted with challenges, being able to build on that foundation and maintaining open lines of communication, I think is especially key. And before you know it, there are many more hands grabbing a hold to pull in the same direction.
Oh, I have great hope in the future of leaders. I see individuals who are curious. I see individuals who are deeply committed to people and healing. I also see individuals who are very capable. Like, there are situations and circumstances shift and change, but capability, I believe we have a more capable population of leaders growing right now than we've ever had before. They have people skills, they have technical skills, they have the ability to knock against doors that we should have knocked against a long time ago. Healthcare is challenging and it's changing.
Behind every confident leader is a story most people never hear, a story of uncertainty, resilience, learning, and becoming. Perhaps leadership is not about eliminating self-doubt, but learning how to lead through it. And perhaps the future of healthcare depends not only on developing skilled leaders, but deeply human ones.